Nào, sẽ thử được.
We can be superheroes. We are living in a state right now where we have no control over anything. These are unprecedented, frightening times where everything is beyond our control, except for we as survivors can help. We can be the ones running towards the fire in our own internally built hazmat suit. And we are keeping a running list of every study that we can find around the country and making those available and acting as a matchmaker of sorts between research institutes and survivors to make the system more efficient and expedite the process, because we don't have time to waste. Lives are on the line.
We don't understand a lot about the immune response to this virus. We're assuming it's similar to other viruses, and there are good reasons to think that. And so we think that within 7 to 14 days after the onset of an infection, that people will develop an immune response and eventually make high amounts of antibodies. Although exactly when the peak of antibody production will be, we don't know, and how long it will stay permanent, we also don't know that either. This is a crisis, and so we understand, and we are amenable to doing things that will take shorter amounts of time, but hopefully will yield at least some rigorous results. And so what Eldad described as a controlled trial with plasma, with normal volunteer plasma versus convalescent plasma, are things that we firmly believe in, and some of the clinical.
And so it's really important to have enough plasma, and so it's really important to have enough plasma in our supply so that we can support the trials and support the compassionate use, because otherwise we won't be able to figure out where this works best. And that's why we need as many donors to come out and donate blood, because we need to fill our blood bank with plasma so we could do the trials appropriately to really figure out where this works. Big names and things, but people have put their egos aside and banded together to try to work together for the common good. And I think in the end, science will win out. And so I think I am hopeful, and I'm hopeful that something will eventually work and slow the virus and buy us more time, and eventually we will have either a vaccine or a drug that will prevent the severe illness, and then everyone